Okay, it's great to see so many people for once instead of doing it through Teams. And it's a great pleasure to open this conference today, the first face-to-face World Suicide Prevention Day conference in Cheshire and Merseyside since 2019. And whilst we have had online events in 2020 and 21, today is a real opportunity to hear from professionals and those with lived experience of suicide directly and network during the break today. Something we have missed over the last few years, the wider connections and social gatherings, both professionally, but also our personal lives. And just coming along today, talking to people on the table and over coffee, it's great to get that interaction going once again. Today is about hearing from people and really listening to the impact of suicide on them and understand what we can do to take action. The new strategy for Cheshire and Merseyside is a framework to be used by all to understand how and where you can take action to prevent suicides. It is more pertinent than ever we support each other and take action. Without a doubt, we are going into difficult times with the pandemic and waning, but a cost of living crisis on our doorstep. We should never assume the difficulties that people may be facing, and therefore the more of us that have the awareness and tools at our fingertips to support people in need, the more likely we are to make a difference to people's lives. The strategy has tried to illustrate the real complexity of suicide, showing the risks in each stage of life. However, suicide and the reasons are complex, and therefore we need to be conscious of that and try and support those who lack hope. Whilst there are many risks, our main priorities are to focus on four. First, men's emotional well-being, as over 70% of deaths in Cheshire and Merseyside are in men. And whilst we should not ignore women and their emotional well-being, we need to think how we can effectively engage with men to support them in times of need. Second, those who repeatedly self-harm in all age groups are at higher risk of suicide, and we will hear later today about self-harm and services within Merseycare to help. Thirdly, in areas of poverty and deprivation, there are generally higher rates of suicide. We must address these inequalities, which are wide-ranging, and the ICS is working alongside CHAMPS and Public Health Network on addressing the causes of inequalities through the Marmot Communities Programme. And fourthly, events in childhood have a significant impact on adult well-being. Therefore, addressing these issues will help to prevent suicides in young people and adults in the future. Whilst we focus on the above priorities, we must not forget that some of the most effective preventative measures are around reducing means of suicide. And therefore, we will continue in Cheshire and Merseyside to use our data and intelligence to focus on methods and places where suicides are most prevalent. We know there is a new national strategy due in the new year. However, we feel in Cheshire and Merseyside we must take action on our strategy and reflect any new upcoming information that will help us in the future to tackle the underlying issues and challenges to suicide. I do hope you today enjoy the day. And whilst this is a difficult subject matter, I know we have some committed and motivated people in this room across Cheshire and Merseyside who will make a positive difference to people's lives. And that's all of you, all of your friends, all the people you know in terms of helping and supporting and getting the message out. I would like now to pass over to Tim Welsh, who is the Chief Executive of Cheshire and World Partnerships, NHS Trust, and Senior Responsible Officer for Mental Health for the Cheshire and Merseyside ICS. Over to you, Tim.